Okay, we're going to start now. I'd like to say good afternoon or good morning from those of us on the West Coast. My name is Professor Pat Dudgeon and I'm delighted to welcome you here today for the launch of the Manual of Resources in Aboriginal Torres Strait Islander Suicide Prevention. I would like to acknowledge all the countries from which we're joining this meeting. I'm on Noongar Boodja and I pay respects to all elders, past, present and emerging. I'm from the Bardi people of Western Australia. The Centre for Best Practice in Aboriginal Torres Strait Islander Suicide Prevention was established in 2017 as a consortium of the Poche Centre for Indigenous Health at the School of Indigenous Studies at the University of Western Australia. Our partners include the Healing Foundation, Telethon Kids Institute, the Menzies Institute for Medical Research and Health InfoNet. These partners are with us on today's call and I'd like to acknowledge them all. The centre was funded by the Commonwealth Government in recognition of the terrible toll of suicide in our communities. Half a century ago, suicide was unknown amongst Aboriginal people. Now it's the biggest cause of years of life lost amongst Aboriginal Torres Strait Islander Australians. 6% of all deaths amongst Indigenous people, it accounts for 6% of all deaths amongst Indigenous people versus 2% for non-Indigenous. It is the second leading cause of death for Indigenous males versus the 10th leading cause for non-Indigenous males. It is the 7th leading cause of death for Indigenous females compared with the 23rd for non-Indigenous females. 40% of all Indigenous youth deaths are due to suicide. 23% of all suicide deaths in Australian children from the age of 5 to 17 are Indigenous. These figures tell a devastating story of despair and trauma, particularly amongst our young people. In the last decade, our suicide rates have continued to escalate. In our earlier work, through the Aboriginal Torres Strait Islander Suicide Prevention Evaluation Project, or ATCPAP, we established the connection between suicide and the experiences of colonisation, structural racism, and continuing social and economic disadvantage. We described how these experiences undermine Indigenous people's social and emotional well-being, which encompasses the health of our bodies, our minds, our spirits, families, communities, our countries, and our cultures. We demonstrated that programs that honour and restore our culture through language, dance, art, craft, kinship, and community can strengthen our people's social and emotional well-being and protect against suicide. That thinking has been widely accepted and is at the heart of Indigenous suicide prevention policy, including the draft National Aboriginal Torres Strait Islander Suicide Prevention Strategy, which has been led by Guy Dewey, Proud Spirit Australia. I'm proud that our work has had such an impact and influence. The Manual of Resources in Aboriginal Torres Strait Islander Suicide, which we're here today to launch, is the next stage in that journey, bringing the resources that embody the ATCPAP principles to a broader audience and enhancing their principles to save lives. We will be talking about the manual in more detail later in our program, but now it's my pleasure and great privilege to introduce the Honourable Ken Wyatt, AM, the Minister for Aboriginal Australians and a fellow West Australian. We are fortunate at the Centre for Best Practice to have such a strong relationship with Minister Wyatt, and we appreciate his understanding of these issues and his strong support for our work. The Honourable Ken Wyatt.
Hi, Pat. Thank you very much. I enjoyed listening to you recap on the important work that is being done. Thank you for an opportunity to speak at the launch of the Manual of Resources in Aboriginal and Torres Strait Islander Suicide Prevention. I'm joining you today from the lands of the Ngunnawal people, and I'd like to pay my respects to Ngunnawal elders past, present and emerging. And for those of you on call who've been affected by the death of a loved one, lost too soon to suicide, please accept my deepest and sincere condolences. I'm pleased to be part of the launch today with so many mental health experts, researchers and community leaders. Suicide, as we all know, is devastating for families and communities. Any death by suicide is a lost opportunity, and each one serves as a constant reminder of what more we need to be doing to give our people hope for the future and the support they need to overcome their darkest hours. The rates of Aboriginal and Torres Strait Islander people, particularly for young people, are unacceptably high, and I congratulate the Centre for Best Practice in Aboriginal and Torres Strait Islander suicide prevention on the launch of this excellent resource to address Aboriginal and Torres Strait Islander suicide. This is responding to a need for simple guidance that's easy to access on actions that can be taken to help someone in crisis or with more ongoing mental health issues. We know that there is a need to reach people in distress earlier to prevent the onset of suicide behaviour. A focus on prevention and early intervention with a more integrated and compassionate mental health system is the key. The government heard these messages loud and clear through the Productivity Commission's inquiry report on mental health, the National Suicide Prevention Advisor's final advice, as well as the Royal Commission in Victoria's mental health system, including the voices of our people in both the Kimberley and Darwin roundtables. For this reason, the 2021-22 budget included the single largest Commonwealth investment in mental health and suicide prevention in Australia's history. A record $2.3 billion, including $79 million specifically earmarked for Aboriginal and Torres Strait Islander mental health and suicide prevention. The Australian Government will continue to partner at the national level with Aboriginal and Torres Strait Islander leaders in mental health, suicide prevention and social and emotional wellbeing. We will also continue to work with communities and Indigenous organisations to better design and deliver mental health and suicide prevention services that meet the holistic needs of Aboriginal and Torres Strait Islander people. Having looked at your publication on site and looking at the manual of resources, I am deeply impressed by the way in which, as a user who's not within the profession, I'm able to find the materials that help me. For clinicians and those who work in mental health, that section also provides excellent advice and support. And for the primary health networks, what you have is an exemplary site that provides so much. And so to me, it's a great privilege to launch the manual of resources in Aboriginal and Torres Strait Islander suicide prevention. And may I congratulate everyone who has been involved, and in particular, Pat and Tom, for your leadership and advocacy in conjunction with all of the others. Take care and well done. Vision.
Okay. Thank you, Minister Wyatt, for your moving words and your continuing commitment to Indigenous suicide prevention. The Centre for Best Practice and many other of our colleagues working in this space are encouraged by the announcement in the budget, not just the scale of investments, but also their new empowering approach to Indigenous suicide prevention services. In particular, nominating Aboriginal Torres Strait Islander community organisations as the preferred providers. This represents an important change, empowering communities to take charge of their own destinies. It starts to bring to an end the long era of Aboriginal and Torres Strait Islander people being told what to do. So thank you, Minister Wyatt and your government colleagues, for listening to our people and making these investments. We do greatly appreciate you being with us on this webinar and part of the launch. Professor Tom Calma is our colleague and patron and chair of the Poche Indigenous Health Network. He holds appointments at the Australian National University, Macquarie University, and the Universities of Sydney and Queensland. Tom is a former Social Justice Commissioner at the Australian Human Rights Commission and has been a tireless advocate for our people. Welcome, Tom. Is Tom having problems?
All right.
You've muted yourself.
Yeah, I'm unmuting. I'm unmuted, I hope, now. Yeah, thank you, Pat, for your introduction at the beginning, and also can I reiterate the words of Minister Wyatt in that acknowledging all of those who have been affected by suicide of a loved one when they've taken their life, or those who have had lived experience in any other way. And the other important thing that is to recognise that we do talk about statistics, but we also recognise that all of those statistics are in fact loved ones. But it's important when we have to get our messages across to government and to other authorities to talk about statistics. But please recognise that we all recognise that they're a loved one of somebody. Can I acknowledge that I'm on the land of the Ngunnawal people here in Canberra, coming through to you, and pay respects to elders past and present, and recognise all the other traditional owners and custodians around the nation who are online today. And I see that we even have some colleagues from New Zealand. Kia ora. Can I say also that what we're doing today is so important, and we want to make it an interactive session a bit later. So, you know, feel free to ask those questions through the chat line, or if the opportunity arises, to come online a bit later. It's an important day today because of the launch, and so we want this to be as effective as possible. I'd also like to recognise not only Minister Wyatt in his role as the Minister for Indigenous Australians, his current role, but in his former role as the Minister for Indigenous Health, and the support that he's given, as Pat mentioned, but also recognise Minister Hunt and his team, and who have worked with us, and people from within the Department of Health who have worked with us in this process. When we think about suicide amongst Aboriginal and Torres Strait Islander people, we need to understand the suicide in the context of the history of our people. In 1788, we began to experience a profound traumatisation of our peoples and all the events associated with colonisation. That is really only a few generations away from our people today, and it's still within the lived experience of many of us, and particularly our elders who have experienced firsthand the impacts of government policies. We were forced off our country and confined to missions. The experiences of stolen generations compounded the effects of colonisation, and we know now through all the work of the Healing Foundation and others the impacts that colonisation has had, not only on our stolen generations but all of our people. And I'd like to recognise the Victorian government and the big steps that they've taken now to establish a commission to really look at the impacts of colonisation on our people. And I think it will be something that we know about already, but it'll be a chance for 5 commissioners to be able to report back to government exactly what those impacts are and how it's going to affect how it's affected our lives, both intergenerationally and transgenerationally, but also how we can look at measures to address them. These are also the results of racism and assimilationist beliefs and policies that government perpetrated. The trauma is transmitted, as I mentioned, down through generations and family lives. In 1967, supported by more than 90% of Australians, it gave us, as Aboriginal and Torres Strait Islander people, recognition to be counted on the census, and so for many of us, seen as citizenship or a right to legal equality. And we're still waiting to achieve both those. But it did nothing to fix what our colleague, Professor Helen Milroy, our first Indigenous doctor and psychiatrist, has described as normative instability. We experience racism and verbal abuse at high levels today, as we have throughout our lives. Our children are still being removed and our people still die much younger than other Australians. These are what we call social determinants of health, including poverty, inadequate housing, poorer access to employment and education, and high levels of incarceration. They affect our people disproportionately, and we have to address them. And that is why in the National Aboriginal and Torres Strait Islander Health Plan, implementation plan, we've now thrown the social and cultural determinants lens across all of our health activities. And that way, we're then committing not only the Department of Health to address the health issues, but all government departments to recognise that they all have a responsibility, that we all have to address all of those other impacts on our lives, like housing, employment, etc. All of these factors undermine us and disempower our communities. All of these factors are linked to our elevated suicide rates. We've yet to be able to demonstrate that in a meaningful way, but we do know that when we look at other countries, and particularly Canada, where they have cultural continuity, where they have language, where they have, in many cases, stable governance and housing, they have less incidence of suicide. We have to be able to show that they are the impactors for us. So we need responses that address all of these issues and avoid seeing suicide only as something isolated or separate or trying to relate it back to a mental health issue or another issue. All of these are contributors. For the first time last year, federal and state governments have signed up to a national agreement on closing the gap. Now, this includes also for the first time targets that were co-designed with us and targets for improvement in multiple measures. These targets include significant and sustained reduction in suicide of Aboriginal and Torres Strait Islander people towards zero. They also include targets relating to youth employment and education, appropriate affordable housing, reducing incarceration of adults, reducing youth detention, reducing family violence, promoting connection to country, access to culture and to language. And as you can see, they all have a relationship to us as Aboriginal and Torres Strait Islander people and our self-worth, and as Pat described, our social and emotional well-being. All of these are essential to providing real practical equality for Aboriginal and Torres Strait Islander people and honouring our cultures. These measures would start to reverse the entrenched discrimination, disadvantage and disrespect that have resulted for far too many of our people in suicide or self-harm. So we look forward to seeing in the near future how governments intend to meet these commitments and the funding they commit to doing so. And the Coalition of Peaks and other bodies will be keeping a close eye on how government is implementing these policies. And it goes beyond just the National Indigenous Australians Agency or the Department of Health. It goes to all the other agencies of government, both at the federal level and the state and territory government level and the local government level, to work together to achieve the outcomes that we need. Overarching all of these individual closing the gap targets is a commitment to devolve and share decision-making with Indigenous communities and Indigenous peoples. Most important, we have not had that in any meaningful way for decades, if we had it at all during the period of ATSEC. Because, as Pat's work in ATSIPEP described, Indigenous suicide prevention is not just about delivery of interventions. It's also about people's leadership, our authority to make decisions, and our communities in our community's interests. It's how do we engage in a meaningful way, and how do we have a meaningful role in our own future and in determining how we exist, and not to be under the guide of government, but to give us the rights to self-determination. Far too often, and still today, this essential agency over our own lives is unavailable to us. A voice to Parliament, potentially enshrined in the Constitution, would enable our people to provide advice to the Parliament on policies and projects that impact on our lives. A voice to Parliament was a key element to the 2017 Uluru Statement from the Heart, and has been called for by our people for many, many decades now. It offers a constructive path forward towards better legislation and policy making through, excuse me, through which governments can properly acknowledge and perform their responsibilities towards our peoples. Many argue that it is essential that the voice is included in the Constitution because we need it to ensure that progress is maintained across all domains of our lives, and that any gains we make cannot be reversed. The terrible suicide statistics that Pat showed earlier motivate us in our campaigning for proper constitutional recognition of Aboriginal and Torres Strait Islander people. So we will continue to advocate for a formal voice to Parliament and recognition of First Peoples in the Constitution. Thank you, Pat, for the invitation to be here today. The Manual of Resources offers an excellent example of Aboriginal and Torres Strait Islander people's leadership in creating and sharing information that meets our particular needs and empowers our communities. I wish the Centre well in the Manuals project, and in all of your work. Thank you, Pat, for your leadership and the leadership of your team. Thank you, folks.
Thank you. Okay. Thank you, Tom. You put our work in suicide prevention into this broader context, and that's appreciated. We found that early on, and I'd like to acknowledge and thank you for your leadership in suicide prevention. You've been involved for decades, and I think that we share satisfaction that of the positive changes that have been made, particularly that investment into our Aboriginal suicide, Aboriginal and Torres Strait Islander suicide prevention, and the way that the government expects that to be dispersed. So self-determination, very important, community ownership, community agency. Now we'll move on to the manual, and this is an opportunity to look at the manual and see how it supports the principles we're discussing. Suicide prevention is everyone's business. So Julie will talk about the different audiences, but we need to work with our own people to facilitate their empowerment, but we also need to be working with non-Indigenous service providers so they know how to work best with Indigenous people and to be part of us preventing suicide. So without further ado, I'm going to hand over to Julie Robotham to present our demonstration. Julie.
Thank you, Pat. And I'm joining this meeting from Gadigal country, and I pay my respect to elders past, present and emerging. As Pat described earlier, the intention for the manual is to build on the strengths of Pat's original work in ATSIPEP in order to provide practical guidance for a wide range of audiences in a wide range of different situations. And when we started on this project last year, I think that we thought that that would take the form of a number of documents, checklists, guides for different communities in their work in suicide prevention. But last year we consulted broadly with communities and with clinicians and funding organisations, including the PHNs, and people told us that they wanted something different. It's not that there's a lack of information out there, it's that there was a need for people to have some navigation of the resources that are available, to know what is current and safe and relevant to Aboriginal and Torres Strait Islander people. So with that in mind, we changed our approach towards the development of the manual. And what I'm going to show you just now is really the outcome of those consultations last year. And thank you to everyone, and there were very many people who are here today who were part of those processes last year for all of the advice that you've given us. So I'm now going to share my screen. Chris, I'm going to need your help in being allowed to share my screen. Could I have some technical support here, please?
Be a technical glitch.
Okay, here we
And
go.
it was yours.
Thank you.
Sorry. Looking good.
Here we go.
Cool.
Okay, so so you see the screen, and this is the introduction to the Manual of Resources in Aboriginal and Torres Strait Islander Suicide Prevention. And it is an online only resource. We've developed ourselves some resources within the manual, which are downloadable resources, but primarily this is an online entity, and that's because that's what people told us that they wanted to see. And the manual is a collection of resources that we have curated to meet the needs of 3 different audiences primarily. Community, which we consider to be myself, my friend or my family member, and my community. And then clinicians and other workforces. And finally, primary health networks and other funding organisations. And we can't go through the entire manual because it includes about 400 resources. And so I'm going to just show you some highlights from each section. And as Epin has mentioned in the chat, please do put any questions up or any comments, and do raise your hand in the chat because I think we will have time towards the end of the meeting to accept any questions. So this is the first of all, I'm going to show you the
Julie, you're frozen.
you will
Okay, now.
You'll see that we have resources laid out visually with an icon above each of them. And these icons are to make the point that the Manual of Resources is not just about written resources. It's not just about reports, guidelines and checklists. It includes a whole lot of multimedia resources. We've got videos, podcasts, tutorials and graphics, and this was a very clear message that came through in our consultations last year, that people did want video in particular. And the manual includes a lot of these, so you can see immediately from the icons what kind of resource that you're looking at. And then people told us also that they wanted resources that work well on a mobile, sometimes with poor reception in remote areas. Because it can be frustrating if you start downloading or streaming something that turns out not to be the thing that you need. So we've included these short pop-up descriptions. Excuse me, I did not mean to do that. I meant to show you one of the descriptions. that's okay. We will move forward. We can look at one of the other descriptions here. Read more. So it just tells you what you can find under each of those resources here, tells you what you're likely to find, and you can figure out from that whether you're likely to want to use the resource. The other thing I'd like to mention here is our graphics, and these graphics were created by Ricky Salam of We Are 27 Creative. Ricky was born and raised on Yidinji land in far north Queensland, and he's got cultural connections in the Torres Strait and with the Ngai Tahu people in the South Island of New Zealand. So we think that these icons, which represent well-being, positivity, empowerment, and connection, are a great framing for the resources in the manual. And they've been animated by our talented web designer, Ashley Ma, also optimized for quick download and use on mobiles. So, to look for a moment at these individual sections, we do have a section for youth within the community element of the manual, and you can see the navigation along the top here: resources for individuals, young people, families, friends and elders, and resources for community development. So we do have time, I think, to play one of these resources just as an indication of the kind of thing that you will find within the manual, which people, both community members and also the clinicians and frontline workers consultations, told us are really, really valuable in promoting a strengths-based conversation and working with young people to talk about strength and capacity in culture. So this video is just a couple of minutes long. It comes from the Northern Queensland PHN with Desert P Media, who have created a lot of the wonderful videos that we have compiled in our manual resource. And Desert P have worked with a number of PHNs and communities around the country to develop these wonderful resources with community. So without further ado.
It's good to have you come over today. I wanted to have a yarn with you and see that you know what happened many years ago. Our people was free to wander and to hunt. And then colonization came in and spoiled everything. They've been rounded up like a herd of cattle and put into a mission. And another thing, they had no freedom. Little children like Joel and Ray, you know, smaller kids, they was taken away from their mums and dad. You can imagine they would have cried for their mum and dads at night. That wasn't fair. They had no rights in getting our people. Plus, they are the first Australians. And we're proud of it, aren't we? That's why we're telling you the story. So you know what happened in the past, that it was very hard for our relatives. Some are still traumatized by what happened.
I had to come to Cranda to find my family because I was never told who my mum was. So you are lucky that you got all these out here telling you who you are, where you come from, and who your people are. When the time is tough, and you know you're going to that place, talk to somebody. And I still go back to sometimes that place, and I keep it at bay. I talk. They're my strength. See in the community who you talk to, who you trust.
We ring each other all the time to check that we're okay. How are you feeling today?
You as future leaders will have to communicate together. So because you get your strength from one another. That's the only way. And talk about everything. When there's the government ain't doing anything, get a plan and see how you're going to address it, okay?
And that's what keeps us going, passion. Passion for our people, for a better future. We want a better future for our children. We want a better future for our grandchildren. And that's a passion that each of us ladies have within us.
They think they can break us, but they can't.
So yeah, that wonderful resource, people told us that those kind of resources, those sorts of video resources can really help guide conversations when someone's in distress, reflecting their experience holistically without reducing people to lists of symptoms. And these are really wonderful strengths-based resources that empower people and celebrate culture and self-worth and survival, and communities and clinicians as well told us that that's what's required. So please do have a look through this section of the manual, which includes resources in community languages and animations for younger children, as well as two-camera lived experiences told by teenagers and young adults. If you are a clinician or if you are from a funding organisation, please do look through this other section of the manual as well. Please do look through the whole thing, because you may find things that are valuable to you to support your practice that are not in your own immediate category. And we'd appreciate any feedback on how we've organised these resources and whether they're properly accessible to all of the audiences that we're looking to include. So moving on now to this section for clinicians and other workforces. Clinicians told us that they needed guidance about how to support people in a culturally responsive way. And they said that they understood in theory how to do this, but in practice, many felt that they lacked the relevant experience and they certainly lacked confidence in supporting Aboriginal and Torres Strait Islander people. So we've included video resources for clinicians and workforces that show what a culturally safe consultation with a client might look like. And we've also included information on cultural respect and self-care for practitioners. And here you can see that you can navigate quickly between those different sections of the clinical and frontline workforce section of the manual. And we've summarised the policies also of the main Indigenous and mainstream peak groups, so that individual practitioners can understand what level of cultural competency is expected from them. And we've been previewing this section of the manual with a number of groups recently, and one of the things that we've heard is that this resource collection is likely to be valuable well beyond the suicide prevention, social and emotional wellbeing and mental health workforces. We heard from people who joined us that these materials could be used by teachers and by family support workers and in the justice system. So as we develop this manual, we're going to be taking a very inclusive view of who these suicide prevention workforces are and what information they might need. Another important point here, all of the resources in the manual, apart from a handful of policy documents, have been developed by or with Aboriginal and Torres Strait Islander people. Most are published by Indigenous organisations, and we have included some resources from mainstream organisations, but only when there's been clear evidence that they have been co-designed with Aboriginal and Torres Strait Islander people. So we've been quite strict about that as our criteria. We haven't included any purely mainstream resources here, and that's not because they may not have value. Some of them may well do so, but this is a space that emphasises Aboriginal and Torres Strait Islander perspectives, Aboriginal and Torres Strait Islander voices, and that's what's really distinctive, I think, about this collection of resources in the manual. So please do come back and see what we have here. I'm just going to flick briefly down and you'll see that we do have lots of resources for different sort of stages of the suicide prevention journey, the cultural understanding and respect, which is so important for clinicians and those workforces. And we'll plan to include some more video resources here. Promoting resilience and preventing suicide, again, with first-person testimonies from Aboriginal and Torres Strait Islander people who work in these workforces, and continuing all the way through the sections that you see at the top here. I'm going to move forward now into our section for primary health networks. We say primary health networks, and that is certainly what the Centre of Best Practice was initially funded to support. But really, all of these resources are just as relevant for culturally respectful and appropriate funding of Aboriginal and Torres Strait Islander suicide prevention services. If you're not from a PHN, but you are from a state government or from a large NGO or other mainstream funding organisation, you'll find things here that will support your practice. Another thing that we should note up front here is that PAT and the Centre support direct funding of Indigenous community organisations to deliver services to Aboriginal and Torres Strait Islander people. That is something which has not happened fully yet, as Professor Tom Calma mentioned earlier on. It's by no means a universal policy that funding goes directly to Aboriginal organisations, though we are pleased to see in the most recent budget some steps in that direction. But meanwhile, while funding still flows to the sector via the PHNs, there are ways of commissioning services in ways that support communities' leadership and their self-determination. So with that in mind, the PHN section of the manual brings together resources to help PHNs understand the big picture of their commissioning role. Includes government's guidance documents for PHNs and their commissioning. So this is a lot of quite technical policies which have been brought together here for, as far as we can see, the first time, and other policy resources, including the Closing the Gap commitments that Tom Calma spoke about recently. The reconciliation action plans, it's certainly been an expectation from the government that all PHNs should have a reconciliation action plan, and many of them do. Some of them are still at this stage don't, but this section will navigate you through all of the PHN reconciliation action plans, really highlighting the progress that has been made so far, but also hopefully giving others ideas about how to approach that. Similarly, a guide to suicide prevention trials, the national and state ones, highlighting those suicide prevention trials where there has been a particular emphasis on Aboriginal and Torres Strait Islander people. And there are some interactive elements in the commissioning section of the manual. I just want to show you a couple of these. So here are some checklists to support culturally responsive commissioning of Aboriginal and Torres Strait Islander suicide prevention services. These are in response to comments that we hear from some PHNs that the ATSIS-PAP report and other documents that really have espoused the principles of culturally safe commissioning, people very much appreciate those reports, but they find it hard sometimes to operationalize those in their daily work. So this is some checklists that we have developed based on ATSIS-PEP and the Indigenous Governance Framework and the National Cultural Respect Framework and the 5th Plan, and also the government's advice to PHNs, bringing those things together and building them into some checklists that PHNs and other funders can use. So here, for example, building organizational capacity to work under Indigenous governance, a really key element of ATSIS-PEP and a really key element of positive commissioning. So that checklist is here, understanding how whether the executive of a PHN recognises the need for self-determination in Indigenous communities, including self-governance. And so then you can write your Response to that question in here can be as long as you like, and questions which take you through this whole issue of working under Indigenous leaders. At all levels of our agencies, our work directed and guided by Indigenous health professionals or Indigenous leaders in their own communities. And so a simple yes, we regularly consult with local elders and community groups. Again, this is a free form text field, so you would write whatever was the correct response for your organisation. And then at the end, you can compile this and make it into a printable checklist. So here's one I prepared earlier. And so you'll find a printout which is developed with the manual's branding. And really those printouts then become a business case for organisations to work within their own organisation to persuade others, including executives and boards, about what they need to do next to increase and improve their work in culturally safe and responsive commissioning. So we think that that's going to be a really valuable tool. We've had a lot of feedback from PHNs that sometimes there are within PHNs isolated areas where people understand how to do this, but what is needed is that ability to persuade executives across the whole organisation. So we really hope that that's going to support this. And finally, I want to draw attention to a couple of stories of positive commissioning. This has been far and away the most popular element of the PHN section of the manual as we have worked through it. And you can see that we've got 3 case studies here. We're very eager to build this section of the manual up further. This is areas where a PHN has really solved some of those challenges around culturally safe commissioning by working with their local ARCHO or other community organisation to develop ways of developing and funding services that respond to the community's needs, while also responding to PHN's needs to be able to equip their funding to government appropriately. So these are really inspiring studies and stories, including a video story here from Western New South Wales PHN, who worked with their local ARCHOs to develop a program to fund local community members through TAFE to become community workers, mental health workers, and that is just really inspiring, because PHNs tell us that one of the major issues is finding the appropriately qualified workforces in their areas. So please do come back and have a look through all of these, and please do give us suggestions about additional resources that we should include, or additional instances of really positive work that you have seen out there in your community that you would like us to profile here. We're really enthusiastic to build this space into a shared space with PHNs and communities to highlight examples of good practice. So I'm going to hand back to Pat Dudgeon now, and we do have some comments in the chat, I think, which we can come back to in a minute. But Pat, I am going to hand over to you to talk us through the end of the meeting, and then we will come to questions.
Okay, so I should close the meeting? Yeah. Okay, so I'm going to close the formalities, and then we're going to, am I on? Yeah. Yeah, I'll close the formalities, and then we'll share, we'll answer some questions. I understand that some of our partners, such as the Healing Foundation, Fiona Cornford and Tanya Hiravonen are here, so I'd be inviting them to make comment too. But I'd like to close the formalities part of this launch and say thank you, Julie. And I'd like to also give thanks to Minister Wyatt and Professor Tom Calma for helping us make this launch of the Manual of Resources such a great occasion. So we're really excited. You know, this does bring together a lot of our existing work. We're going to be seeking new resources and also visiting our Aboriginal colleagues and sister brother organisations to see what they'd like to contribute to our resources. So it's going to be a strong, positive and developing resource. I'd like to thank everyone who has participated in the webinar today. We're pleased and honoured that we have had an extraordinary turnout of people from all over Australia. So it's been great. I think we've had how many people? 250? Yeah, so to me, that's a pretty good number, 250 people from across the country and New Zealand. So we went international there. So thank you people for attending our webinar. We've had some wonderful supportive comments and suggestions, which we're going to take on board. So that's all in the chat. Do make comments if you see a really great resource that we didn't scoop into our net right now, tell us, because this is going to be as good as what we all make it. So it's important for us that we're developing a resource that's directly responding to the needs of either our community, frontline workers, or funders and non-Indigenous organisations. So if we don't have the resource there already, we'll look at partnering to develop resources, or we could easily find them if they're in existence. This is a living online document, and we're committed to updating and expanding it. So it's going to fulfil its critical role in promoting wellbeing and preventing suicide for our people. The manual's here to support your work, and we really want to know what you think. So do make comments. Visit the website. It'll be going live this afternoon. So do visit and say what you need to better your work. Do stay in touch, give us feedback and suggestions. But that's all from me right now. I'm going to close the formal part of the meeting, and I'm going to now address some of the great questions that have been asked. There's a question saying, what are there resources for people who are bereaved by suicide and for non-Indigenous services supporting our First Nations people who have lost someone to suicide? There are resources. Julie, I'll throw over to you, but one of the other centre projects, so we're doing lots of other little projects too to fill gaps on what's available out there. But one of our projects has been working with Origin to develop a guide, a little handbook for people who have survived suicide or carers of or bereaved people who have lost someone to suicide. That was originally undertaken for non-Indigenous people, but we've been working on it and taking it out to community groups and getting a lot of feedback. And the community's really pleased with this resource. So there will be a booklet coming out, and we'll investigate possibly also making that into a video or some kind of interactive resources. As Julie said, different things work for different people. So even if we do develop something, we should also look at how do we repackage that, present it so people can access it. But Julie, over to you. What do you think? And I'll have a look at the next, find the next good question as well. Julie?
Yeah, Pat, I'm just got a few little technical issues at this end, and I can't see the chat. Would you mind telling me the question again? Sorry, one more time.
Okay, it was, are there resources for people who are bereaved by suicide? Now, I'm taking that as Indigenous people, and there are a lot of resources out there, and for non-Indigenous services supporting our First Nations people who have lost someone to suicide.
Yes, there absolutely are, and we have.
No, dropped out. Oh, I think that. Oh.
Can you hear me, Pat?
You've been dropping in and out.
Okay, my connection is unstable. Can you hear me now?
Yes, we can hear you now.
Okay, apologise for that. That's just my internet link. So yes, there are resources for Aboriginal and Torres Strait Islander people who've been bereaved by suicide. Perhaps as many, not as many as we might have anticipated to find. And we would be very open to learning of others that perhaps people don't have published on their website, but perhaps they use within their own organisation. Because we can certainly find a home for those kind of resources on the website. There is, for example, one wonderful resource that's come out of the Victorian Coroner's Office from their Aboriginal and Torres Strait Islander engagement unit there, and it's a guide for Indigenous people around the coronial process. And of course, that is developed in the Victorian context, but I think that you'll find a lot of really valuable advice there. Practical advice more than emotional advice around supporting Aboriginal and Torres Strait Islander families after a suicide. And those kind of practical resources are the kind of thing that we would love to include some more of. So please do advise us of anything else that should be there. And there are other documents and videos there about supporting, in particular, young people who've been bereaved by suicide, and really working with young people to understand in a culturally safe context how to talk with young people about that experience. Second part of the question about non-Indigenous organisations. Yes, for all of these resources, with the exception of a very limited number, which are really expected to be used by Aboriginal and Torres Strait Islander people exclusively, the great majority of these resources are practical resources for Indigenous or non-Indigenous organisations and people to support Indigenous family members, clients, or patients in the case of some clinicians. And so all of the information here, I think, is available and valuable in multiple contexts. And one thing we would really love to know is how you're using these documents and video and multimedia resources, because the more feedback we can get about how people are using these in a practical sense, then the better placed we are to be able to sort of promote them in valid ways. And certainly one of the pieces of feedback that we got was it's not really only about suicide prevention and wellbeing support. It's really about that whole sort of cultural respect element and ensuring that non-Aboriginal organisations understand the cultural context of Aboriginal and Torres Strait Islander clients and families. And so things like kinship structures and understanding those things are really, really important for those professional organisations. Another area that we'd love to build up.
Okay, thanks, Julie. I don't know if you realise, but everyone was feasting their eyes on my lovely face during your talk, during your response, because you weren't sharing your picture or something. I don't know, some technical glitch. So initially I was thinking, oh, I don't mind, go for it, guys. But then I started becoming a bit self-conscious. And I felt like a deer in the headlights. So yeah, I don't know if I want to repeat that experience. Anyways, well, I was going to actually ask the Healing Foundation. I know that Fiona and Tanya are a part of the webinar. If they'd like to make a statement rather than open up to another question, because we've run out of time, guys. I do have a cunning plan though. So after the Healing Foundation, if you want to make a comment, can we patch them in or not?
If you tell me who they are, make them a panelist.
Yeah.
Give me the account name.
Tanya Hiravonen. Yeah.
Allowed to talk?
Yes. So any comment? Yeah, comment. Fiona Cornforth. So Tanya, are you there? They might have left.
Can you hear me?
Yes, we can indeed.
Okay, so I'm just speaking on behalf of the Healing Foundation, and thank you, Fiona Cornforth, for allowing me to be your proxy. Fiona Cornforth is the CEO for the Healing Foundation. We would like to acknowledge the hard work of Professor Pat Dudgeon and your team, particularly Julie Robotham, with the important work that you are doing. And we are proud to be very close partners with the Centre for Best Practice in Aboriginal and Torres Strait Islander suicide prevention. We just wanted to acknowledge that hard work, and also and especially just also acknowledge these are people in communities. We've had needs in communities increase, particularly during the pandemic and post-pandemic. And so this resource and this manual is needed more than ever, and is very, very relevant for the needs of mob on the ground now. The only question that we do have is how, apart from this deadly launch, how are the Centre for Best Practice going to reach community and mob around Australia? Australia is so vast, and just for the people that weren't able to be part of today's deadly launch, Pat and team.
Thank you, Tanya. I'm going to make some comments because we are out of time now, and we need to stay to time. And so sorry, people who've asked brilliant questions, and we've got them all. We recorded it, and so we'll be looking at the questions and the commentary. Thank you for the feedback. So to answer, and Tanya, thank you and Fiona from the Healing Foundation for your support and your inspiring comments, and we'll be meeting and talking about, also utilising some of the Healing Foundation resource. In regards of taking it out to across Australia, as soon as Julie has her second COVID-19 vaccination, she'll actually be taking the manual on a road tour. So we'll be going out and taking it out and meeting with Aboriginal community organisations, also with funders and frontline workers, to at least ensure that people know it's there, and also to get some direct feedback. So the launch is in the finish of it. It is a living document. We will be promoting it and also getting feedback. So that's one thing. What's that? Yeah, it's this afternoon. It'll be going online, so watch this space. But while we were talking, and I realised we were going to run out of time and not answer some of those or discuss some of those great comments and questions, I hatched a cunning plan, everyone, and I'm dobbing Julie and Yiping in for that. Yiping's sitting next to me here. But what I'm going to suggest is that if people are interested, I'm happy to try and organise another webinar where we can just have a discussion about the manual and other issues. So please visit the Centre for Best Practice website. We will announce another webinar, which Yiping, move over here, Yiping. Yiping will help us organise. So, so we'll be having another webinar for a general discussion. So we're so delighted with the response and the questions and the comments that it would be good to continue the dialogue. Another question, good question that came in was, will attendees have access to today's recording? Yes, you will. The visuals anyway, and we might try and do a composite of, I think you can do that thing where you click the chat and all the chat comments get collated. So we'll edit them and make sure, that due sensitivity is shown. But there will be the recording itself and also some of the comments. So I'm happy to have a conversation, a continuing conversation if you are. So watch our website. We'll be inviting everyone back for another discussion. And on that note, I'm now going to close this webinar. Thank you, Julie. You had to do the majority of talking and the work and showing the manual, so thank you. Julie Robotham. I'd also like to acknowledge and thank Minister Ken Wyatt. I think you noticed towards the end of his speech, the buzzer went off in Parliament House, and I think that means that all the ministers have to stampede into the Parliament House meeting room where they can debate laws or whatever. I'm not a politician, as you can see. And also, I'd like to thank Professor Tom Calma. He was actually quite ill yesterday, and it was it wasn't an easy thing for him to attend today, but we were so grateful that he was there. Him and Ken are our leaders. They've been sensitive and concerned about the issues from the beginning, and their support and commitment has never wavered. So things are changing. I'm sensing that there has been quite a considerable change. So we shall all walk into that change, that positive change together. And on that note, I'd like to thank everyone for attending this webinar, and thank all the staff on either side for making it happen. So thank you, everyone. Watch the space. We will continue our discussion.